All right, this video is going to show the basic walkthrough of bringing a COVID patient to the OR direct. The anesthesia provider and the transport team is going to bring the patient from whatever unit they're bringing down through the elevators 9, 10, and 11, and they're going to enter through the double doors of the OR. Stop this one. Go. Once the patient comes through the double doors with the anesthesia provider and the transport team, they're going to proceed to the COVID unit entry.
The team in the operating room would have communicated with the transport team and the anesthesiologist to bring the patient down to the operating room. Two runners on the isolated side of the anteroom will assist the transport team into the anteroom. The outer screen of the anteroom should be closed before opening the final barrier and the patient transported to the room. Being careful to raise the screen as high as possible so as not to drag the screen across the patient's bed and further contaminating the anteroom. Once the patient is through the threshold, his bed can be taken straight to the OR room door and the outer barrier closed.
With the help of the anesthesia provider, the circulating nurse will bring the patient into one of the COVID rooms. The circulator will pull the bed all the way into the room, and the anesthesia provider and the transport team will go into the doffing room and doff their PPE that they brought the patient with. After the patient's arrival, the surgical team should be ready to intubate, prep, and drape the patient. At the end of the procedure, we're going to notify the transport team. The attending anesthesiologist will go through the doffing station, doff, and then re-don and come around and meet the circulating nurse at the front door. The circulating nurse will push the patient through the door to the receiving transport team and anesthesia provider. The anesthesia provider and transport team will then return the patient to the unit that the patient was delivered from.